Good afternoon, my name is Mykola Vyacheslavovych. I am an addiction specialist at the Dr. Blago Plus clinic. Today we are going to talk about a type of addiction to alcoholic beverages known as beer alcoholism, in quotation marks. Addiction specialists do not like this term and do not classify it as a separate nosology of this disease, but nevertheless it does exist and is quite common. What is the peculiarity of beer alcoholism as, let's say, a separate kind of classification? Its peculiarity lies in the fact that it is quite often present in our lives, spanning various age groups from adolescence to older ages, and it is quite popular. So, what is, let's say, the main catch with this type of addiction? For example, if a person drinks strong alcoholic beverages, it is immediately noticeable. Both family and friends, as well as everyone around at work and in society, anyone this person interacts with notice it, and the person seeks help more or less in time. A person who drinks beer over time begins to develop a higher tolerance and dependence on this beverage. In the early stages of this condition, those around the person may not notice any problems because it is still a mild degree of intoxication, lacking any pronounced symptoms of alcohol intoxication such as dizziness, disorientation or speech impairment. And that is why the course of the disease appears somewhat blurred. Similar to, for example, viral hepatitis C, which is often called the silent killer. In the same way, when it comes to alcohol problems, beer acts as a silent killer because at first no one notices anything, everything seems fine, and it is considered just a bit of fun. It is thought to be just mild intoxication. It is believed that you can watch football, catch a World of Sports program or other shows while drinking beer. But over time, people develop a dependence on this type of drink because considering its ingredients, including hops, a very high tolerance develops. So, what are the manifestations of beer alcoholism and beer addiction, and why are they dangerous? First of all, we can distinguish concepts such as, for example, in quotes, the so-called beer heart, beer kidneys, and let's say beer liver. There comes a point in the life of a person who abuses beer when they have to see a doctor because of one problem or another. When they go to the doctor because of certain concerns or symptoms, it turns out that they already have significant heart problems such as arrhythmias or electrolyte imbalance. There are also issues with the liver, including fatty hepatosis, an enlarged liver, some changes in the liver parenchyma, or disorders in the renal tubules. At the same time, diabetes can also develop unnoticed. That is, when a person consumes alcoholic beverages in the form of beer or other low alcohol or other drinks, they do not notice how they are destroying their body. Because, as I mentioned earlier, there are no symptoms of acute intoxication, no symptoms of acute drunkenness, and everything progresses in a very subtle way with a blurred clinical picture. Beer addiction begins at a very young age group, so to speak. It starts in adolescence. From school age, let's not hide this because many school children consume beer or other low alcohol beverages. It can later provoke the consumption of stronger alcoholic drinks, which may trigger severe alcohol addiction, leading to the second or third stages of the disease. Regarding the treatment of this kind of addiction, naturally, no matter how much it may seem that these are, so to speak, low alcohol beverages, that it might all be harmless, or just a way to quench your thirst in the summer, in reality, this is a disease. It is a disease, and there is no point in distinguishing beer alcoholism from regular alcoholism. A person goes through all the same stages, just with a slightly delayed effect. Treating this type of dependence or addiction, whichever term you prefer, should still be done in an inpatient setting, because the first and fundamental requirement is complete isolation from the substances being consumed. A person who is addicted to beer can also experience various psychomotor and psychosomatic disorders, disturbances that can lead to psychosis, delirium, or withdrawal syndrome. All of these conditions must be treated strictly in an inpatient setting. This type of addiction cannot be treated at home because it is not effective. And if a doctor comes to the house and administers some kind of detoxification IV, he cannot be sure that After the IV, the person won't just go to the kiosk and have a glass of beer just like they did in the morning. In other words, it's just a meaningless formality. From the perspective of addiction specialists, this is not encouraged because it is somewhat unprofessional and inappropriate. The most effective method is treatment in an inpatient facility. The course of treatment lasts about a week at minimum, after which an anti-alcohol blockade is administered, just as with the main types of alcoholism involving the consumption of stronger alcoholic beverages. In other words, we conclude that home treatment is ineffective because during outpatient IV sessions, the person is not under control and the doctor cannot be fully confident or assured that after certain medical procedures, the person will not go out and drink alcohol again.